All right. Hello, everybody. Hello, hello. It is so nice to have you guys here. Thanks for joining me. This is SoulPet. My name is Elaine. I'm an animal Reiki master, animal chaplain, animal medium, and this channel is dedicated to all of you who are coping with pet loss. This is the channel that is dedicated to working through whether it's pet loss that has happened a year ago, a day ago, 10 years ago. You are welcome and held here, and we have an amazing conversation for you today. Today, I am welcoming Dr. Duno, Dr. Stephanie Duno, who is she's a veterinarian down in the Miami area, right, Steph? Okay, so
Yes.
in the Miami area, who has recently started her own home practice, a mobile practice for pets, specifically focusing on animals as they approach end of life. And that's how we're going to frame the discussion today. The discussion is going to be framed around what the experience is when our animal companions cross to the other side. And we're going to look at this through the eyes of Dr. Duno, who recently went through her own loss with her beautiful Tequeno. Teque, right? I think is how I heard you
Teque,
refer to him. And that's his
teque.
picture right there in the background,
Yeah,
right?
mister.
Yep, the handsome boy. So first, I'd just like you to introduce yourself if you don't mind.
Yeah, of course. Hi, everybody. I'm so grateful to be here. I love Elaine with all my heart. I have looked up to her for so long, so this is awesome for me. It's like a wish come true. My name is Stephanie. I am a veterinarian. I graduated about 3-ish years ago from UF, Go Gators down in Florida. Um, well, I'm here now. Since I moved from Colorado, I'm here now. And I started doing urgent care. I told myself I wanted to get very good at Western medicine initially. So Western medicine looks more like treating acute cases. Like you think of those surgery, you think of kind of any sort of ear infection, vaccines, more of just that type of medicine. And then once I got really good at it, I told myself I could finally go to my passion, which is traditional Chinese medicine. And it kind of plays in with energy healing, like what Elaine does with Reiki. And that's kind of the transition that I'm in right now. Um, I was expecting to stay a little longer in Colorado, but Teque passed, and I think that just sped up everything. I think the deep pain that I felt like led towards my heart just like cracking open and allowing for this transformation to happen. And now I'm here, and I feel like so much has changed in the past 3 months. And again, I'm like finally like putting my feet on the ground. But yeah, I currently have I started Sana Sana. Right now it's kind of again it's in the works. But I go to people's homes and I basically help with end of life care as of now. And then ideally I do want to expand, but I do think, especially with euthanasias, I think every euthanasia should be done in an at-home setting. I don't think there is any need for any pet parents to have to deal with driving, to have to deal with getting the kids in the car, to go to a place that they maybe have not even been to in the first place,
Mhm.
getting the sick pet already in the car, kind of the whole concept, having to even drive back afterwards, the bright lights in the hospital. I just feel like every euthanasia should be done at home, having a vet come to your house, allowing them to transition peacefully in their favorite room in the house, making it more of like a sacred goodbye. Not that doing it in a vet clinic is bad. I just think that people don't know that doing it at home is also an option, right? And I think I want to advocate for that more.
And I would agree with you. I think that pe there are some people who don't realize that there are veterinarians who specialize in this, who want to do
Hmm.
this. Now, there are cases, right, where emergency cases, you end up at the
Yes.
veterinarian office, and veterinarians, I would say, are, I mean, a godsend when it comes to that because they're so comforting and so able to help you through an emergency situation like that, something unexpected. But if you are able to have somebody come to your home and just do things at your own pace and at your beautiful animal companion's own pace where they're comfortable and in an environment that is so familiar to them.
Hmm.
Yeah.
I love that word, familiar. That's
Mhm.
so important. Because animals are in tune and they know what's going on, and we'll get into all of that. But yeah, if it is an emergency, if it is something that was not expected, please take them to
Mhm.
the veterinarian. But I guess this is more for those hospice end of life
Right.
patients who
Hmm.
have been kind of withering away, and you have been having that conversation with your vet, and you have your little quality of life calendar at home, and you're kind of seeing that there's more bad days than good days, and it's starting to become a conversation of topic. Just know that we can go to your house. Like I would love to go to your house instead so that you can deal with your process of mourning while I deal with allowing them to pass peacefully and making it a nice environment so that, because it sucks. I mean, yeah, we both experienced it and
Hmm.
it's hard.
Well, I'll tell you before we talk about Teque real quick,
Hmm.
because you brought something up, and that was the quality of life assessment. Can you just talk a little bit about how you might help a pet parent who is not sure if it's time for their animal companion, how you might advise them, and what that little quality of life assessment might look like?
Yeah, of course. So I am a huge fan of Lap of Love. It was started by Dr. Elaine McCarty here in Florida. She's actually one of my mentors. I love her, and she has a lot of really good resources on her website. One of those resources is that quality of life
I
calendar
love
that
her.
you're
I love that
mentioning.
one. That's the one I recommend all the time.
It's amazing. And I recommend that you print it out, you put it in your fridge, and as a family, just every day at night, mostly kind of get together and decide if today was a good or bad day for your pet. I feel like when your pet is transitioning, it just, I dissociated. I mean, it was like 3 months of pure dissociation because you're
Mhm.
cleaning after them. I mean, I lived in an apartment and like it was trying to have them eat, like he wasn't eating. And it's kind of like you're stressing, you're trying to go to work, you're trying to do normal human things, you're trying to feed yourself, and then it just becomes a blur, is how my experience was personally. And
Mhm.
I think that calendar allowed me to kind of come back and ground myself and be like, okay, was today a plus or a minus day? Right. And sometimes it was like 2 plus days in a row, and then it was like 3 minus days in a row, and then 1 plus day. So it's like in those plus days, you really start to question like, should I make the decision or not? But when you look at the calendar as like when you see it and you see the X's and you see the check marks, I think it allows you to kind of see like, hey, like it's not going too well, right? Like I think it's maybe it's time for us to consider that because what we don't want is for them to suffer. And I feel like that allows you to kind of see um if it's going more towards the suffering versus enjoying these last few
Mhm.
months or even years.
Got it.
Hmm.
And for anybody who's interested, I'll make sure to put a link to that calendar in the notes in the comments below this recording. Okay, so Stephanie, do you want to tell us a little bit about share your story about Teque?
Yes, oh my God. It's been a year. It was January 15th of last year. And my whole life transformed, honestly. I adopted Teque as an older man. So I adopted him here from Miami-Dade Shelter when I was in vet school. So he was my vet school dog. And he was a stubborn pitty, not good with other dogs. He was drama queen. He loved chasing cats. He was just Mr. Stubborn, which I loved. And we would cuddle every day. He would sleep on me every night. I think that's been the hardest part for me. And just we were together 24/7. It was just me and him. We would travel. I would take him everywhere. All the hotels had to be pet friendly. He was with me up and down. Um, and I got him really sick. So I think we did a ton of surgeries on him. He had to get a TPLO. He had to get several mass removals. He had heartworm. He had a pyoderma, which is like a very severe skin disease, and all the things. And finally, I was able to get him back to health. So we enjoyed exactly 5 years together. And it was honestly the best 5 years. I think it teaches you a lot about yourself, but also about what it means to love someone unconditionally, you know? I mean, like they they just love you. You don't ask
Yep.
questions.
Right, Stephanie, thank you for saying that because they don't care if you forgot to brush your teeth. They don't care that you don't want to get out of bed. They as long as you're with them, they don't care.
Yep, they're like, I'm chilling. So yeah, when he started, it was kind of, I always say that pets come here for a specific reason, and I do believe that we choose each other even before we come here. So every pet that we have had the opportunity to experience in this lifetime, we chose that soul contract with them from way back when, right?
Mhm.
And when I moved, so I moved into this new apartment with him, and it was like from day one to day two, he checked out. He started to get, he got cognitive dysfunction, which is kind of like doggy Alzheimer, and
Okay.
he just was not there. He started to pee and poop on himself. He started to howl constantly the entire day. I started to get complaints from my neighbors. He did it. He was disoriented. He was very disoriented. He was having sundowning syndrome, which is basically when as the sun goes down, they start to kind of just um go a little
Mhm.
crazy. And it in my mind, and you helped me a lot with this, Elaine, it just felt like he knew that his job here with me was done. That's kind of how I took it. He was just like, I did what I need to do with you, and I know that now the next step that you're headed towards is without me. And even though I didn't want it to be without him, they know more. They're tapped into divine light, divine consciousness. So they're already communicating with the divine fully. So they know what's best for us, even though us as humans, I mean, loss and pain is so difficult. They don't experience that. They go straight and back to source. I think they're fully connected the entire way. And of course, they're still in the physical vessel, right? So they, of course, it manifests as all these medical
Right.
everything that he was expressing. But yeah, it was really hard. It was really hard, and it was about 3 months. I was really grateful that my family was able to come help me, because you know you still have to work, and it's like you have to be a human, and you have this sick pet at home that needs your attention a lot of the time. And I was grateful enough to have my family come up. We started to cook for him. We started to just do all the stuff for him. So while I was at work, they were able to stay with him, and I also had family there, and I was blessed enough to have help, but I really can't imagine how it is for some people who don't have that help. So I'm sending you all a big hug, like especially if you're going through that chapter right now. It freaking sucks. And those 3 months was again, it was a blur. It was a blur. And it wasn't until I almost fell asleep with him in the back on my way to work. I almost fell asleep in the wheel
Mhm.
that I was like, okay, like we need to like really like pause and like see what we're gonna do because he wasn't sleeping, he was losing weight. And I think for me, what really affected me was he stopped wagging his tail. And
Oh,
he would wag his, that was his thing. Why he would hit when I got him, he had happy tail because he just all he did is wag his tail. And he stopped wagging his tail, and it wasn't anything orthopedic or any sort of like muscle lesion or anything. I mean, I
right.
made sure we did all the things. I took him to all the vets, and it just I think it was time. They know when it's time, and you know when they tell you like you will know, um, you will know, you will know. And still, even through knowing, I still had like questions, right? But it's not here that I'm here 1 year after that I'm like, okay, like it was time. You see the pictures and you see the videos and you start to like kind of see and you're like, he was ready, you know, he was ready to go. And I think for me, what affected me was, and we'll get into it, just the way that it was handled as a veterinarian. I think you know, I have every vet practices differently. And when it was time to let him go, I had a vet come over and he was wonderful. I just think that I should have done it maybe. But again, this was my first pet that I lose as a vet. So
Mhm.
I mean, and I'm human, so it was kind of like I just wanted like I just needed to be there with him, but I think that if once I do get more pets, I think maybe I'm gonna challenge myself to try to put them down myself. I think
Mhm.
that will bring me peace. Just the way that I am as a person, right? Even though we did it at home, it was beautiful. I can send you pictures. We put flowers all over him. It was beautiful. He transitioned very peacefully, but I felt like, I don't know, I had a friend who she was planning, she was pregnant and she was planning to have an at-home birth. And very last minute, there were complications and
Mhm.
she had to give birth in a hospital. And everything went great, healthy baby, she was great. um but she was mourning that part of wanting to give birth at home, right? And
Right.
I think when she told me that, I was like, wow, because I felt crazy, like everything played out beautifully, but I felt like it should have been different. But like, what should have been different? This is my first experience as a vet, having to put my own
Okay.
dog down.
Mhm. Mhm.
I just felt a lot of anger and like I was like, I should have done it. Like, but it's normal. Like all these feelings, again, I probably sound like not crazy, but all these feelings are normal.
No, that's really what
Yeah.
I love for that. I love this part of the story because
Mhm.
so many of you have come to me and talked about guilt and regret.
Yes.
And I'm talking right now to everybody who's watching, guilt and regret and remorse and all the things that you think you should have, could have, would have done
Mm.
differently. And my answer is the same to everything. And Stephanie, you let me know how you feel about this also, but that when you make a decision for your animal companion that comes from a place of love and you are doing the best you can at that moment in time with all of the intentions to provide whatever your animal companion needs, like then you can release yourself of that guilt. You can release yourself of that regret because you did everything you thought at that moment in time that you could do. And sometimes we're not emotionally capable of making
Hmm.
complicated decisions, even when you've had some time to prepare for it, right?
Yes. Oh my God. Thank you for that. And yeah, like this is normal. Yeah. I mean, it's just it's so hard to be human and the emotions that go through our bodies and just like the mind is so powerful, especially afterwards. Um, but no, I feel like now I'm at peace with it, but it's a hard conversation. I don't think it's something, and I love that you said initially, like pet parents that are going through it, have recently gone through it, or even if it's been 10 years, like it's only been a year for me and like it just I'm trying and I want his life to be celebrated and I want my experience with him to allow me to propel myself to help all these pet parents that are going through this but I still cry in every euthanasia. I mean like and I allow myself to cry because I feel you guys so deeply and I've had and at the same time I love doing it. I mean, when I get euthanasias, I tap into, doctor mode, but also I am an empath, and I feel
Mhm.
like you feel it. I hear you guys. I ask for pictures. Like I want to see what life was like with your pet because I am there with you. And it's hard. It's hard. I don't know what else to say about it. It's just hard. But just know that as veterinarians, like we also we also feel it fully.
Yeah, exactly.
Yeah. Mm-hmm.
And I often tell people the same thing in my work as an end-of-life pet doula, which is to help people prepare for and then be there for them to support them from an emotional and spiritual standpoint. Um, that I cry every time. I mean,
Mhm.
every single time when I'm holding this space with you, I'm right there with you emotionally. And I think that, and I don't know if this is a conversation for a different day, but when you're in the veterinary practice,
Mhm.
um, and you're not going from home to home, or even if you are going from home to home, there's something in the veterinary medicine field called compassion fatigue.
Mm.
And I think that I'm not sure what I think about that, like, and how many veterinarians experience that because of all the emotional connection that they have to every animal that they connect with.
Mhm.
I don't know if that's something you can speak to or not.
Yeah, of course. I think I think a lot of veterinarians are so smart. I mean, we're scientists, we're doctors, we're therapists. We do all of these roles. And I always talk about this in my veterinary community. It's the importance of taking care of yourself after. Every time I have a euthanasia, my team knows that I need at least 10 minutes for me to go outside, touch a tree, take
Oh,
off my shoes, put
yes.
my feet in the ground
Oh,
because
beautiful.
we just I was I just I how do I say it? Um, it's a lot. I mean, like I just helped a soul transition into heaven. I just helped a family feel at peace with their decision of allowing their pet to transition into heaven, right? And when you work with energies, I mean, as doctors, it's so easy for us to study anatomy, study how to read blood work, how to do radiographs, how to interpret findings, but we are working with energy. And that's one of the reasons I did my Reiki program with you. It's because I felt it, I feel it, right? And
Hmm.
one of the things I mentioned was I had a client give me something so beautiful. I have it here. It's a mandala. It's what you wear on your neck. I can get it. Do you want me to get it so I can show
Sure.
it? Yeah, it's so beautiful. So it's the mandala that you wear, and it has howlite and amethyst. And I
Oh,
have it next to my bed.
beautiful.
Yeah.
Yes.
And he wrote me a beautiful note. And he said that when I had the privilege of allowing their pet to pass.
Mhm.
And he said that when it was all happening, he saw an aura of purple and white light mesh around me with his pet. And once I had allowed the transition, because mind you, when I'm doing euthanasias, I always ask, are you religious? Are you spiritual? Are you
Mhm.
okay with me praying? Are you okay with me calling in anyone that has already transitioned to help us help Teque transition, right?
Mhm.
And usually a lot of owners in Colorado were more spiritual, so we would work with I would have incense, and we just kind of we make it very
Yes.
chill. And along this, of course, with the medications that I use, I make sure that the pet does not suffer. The pet zero. The pet does not feel a thing. The pet goes into a divine sleep where they just start snoring. I love listening to them snore, to make sure that they're comfortable, and they never, not for 1 second, feel any sort of pain. Okay, so I want every client to know that, because that's always a question that I get.
Yes.
Um, and no, they don't. But he gave me this because he said these were the colors that reminded him
Of
of what
you.
he saw.
Wow.
And that was so beautiful, because
It
like
is
it's
beautiful.
beautiful. Like I'm feeling it. I feel it. And for someone to be able to see it, I mean, we all have gifts. We all have the gift of either prophecy, or you have the gift of energy. I'm sure that he was clear. I guess when you see energy,
Clairvoyant.
I think clairvoyant is mind,
Okay.
clair and audience. One of the clairs.
One of the clairs. I
One of the
always say
clairs.
that. It's
Yes.
one of those clairs.
One of the clairs.
Clear vision, clear
Clear
sight.
vision. Clear eyes. Yeah, so that was really beautiful. And it just reminds you that, like I am where I'm supposed to be.
Mhm.
So that brings me a lot of peace.
Beautiful.
Oh, yeah.
And speaking of peace, when, and I've experienced this myself, when you have made the decision and you do start to second guess, or you start to question,
Mm,
or how do you help pet parents? Yeah, pet parents. How do you help pet parents find that peace, that they've done the right thing, that they've made the right choice, that what they're doing is a completely selfless act of love.
mm.
Can you speak to that a little bit?
Of course, yes. And I think every pet is different, every situation is different.
Mhm.
But overall, I canceled Teque's euthanasia 3 times.
Okay.
And yeah, and again, thanks to
Thank
the
you for sharing that,
calendar,
because
of
that's another
course.
thing that people
Yeah, yeah,
question.
yeah.
I couldn't go through with it, but then I wonder if I made him suffer for those last month or
No,
whatever. Mhm.
no, 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 no. Again, what you said was so beautiful. As long as you're acting from a place of love for your pet, and knowing that what you're trying to do is from a place of deep unconditional love,
Mhm.
every decision that you make will be fine. This is separate from you, of course, being human and still having kind of like, which is normal,
Yes,
right?
yes.
So just know that, like, try to separate that, because I feel like I canceled his appointment, and that's something I love about Lap of Love and about myself, that if you call me and you're like, he's having a really good day today, like I want to take him to the park, and it's like, have fun. Call me. Like, you let me know I am here for you. Versus I've had clients who I had a case, and so much love. I also do relief work here in Miami, so I go to several clinics. And I had a case where it was a cat, it was like a 7-year-old cat, massive, massive mass on his in his ocular region, so right here,
Okay.
but it was pressing on a lot of other structures, so he wasn't able to eat. Owners had gone through chemo for years, chemo, radiation, they had done all the medications, they had done everything. And at the hospital that I was, the team knew her because she's been there so much, right? And I guess divinely, when she came and was ready to euthanize, it was me. And we, of course, since I hadn't seen the cat, I read through all the history, and I just commended her for her deep love for this pet. Because, mind you, I mean, for his diagnoses, humane euthanasia would have been totally understandable. But this owner, also, she's a doctor. So there's always, again, every pet is different, every situation is different. But I remember when she came to me, she was hesitant. And what she didn't want is for her to make the decision. She wanted me to make the decision.
Okay.
And I remember just sitting down with her and allowing her and just having that moment of us being together, holding hands. And I told her, allow me to make the decision for you so that you can take this time to mourn and be with your baby once he's transitioned instead of being in your head about is should I not, should I not? Because that fatigues, it's exhausting. It's exhausting. So sometimes, especially in these cases where it is a poor prognosis or kind of like the pet is not doing well and but sometimes he does eat, right? But in the majority of time we have those X's on the calendar. Um, allow your vet to make the decision for you so that you know that this came from a medical knowledgey side and also for love for the pet, right? Does that make sense?
It makes total sense.
Yeah, yeah,
It's yes, it
yeah.
makes complete sense.
Hmm.
To allow someone to come in and help you with that decision, to guide you, and
Please.
then right,
You're not alone. You're not
right.
like, please let me take that burden from you
Mhm.
because you're going through enough already. Like the process of having to put your pet to sleep is a lot. And I want to be here for you to know that here, like, I do think this is a good choice right now. Allow me to make that choice for you. And I remember just when we were together, we were sitting, we had the cat around us, her shoulders just like she like I just felt her. She was able to like breathe. And of course, I'm gonna start crying because it was just like I'm so grateful to do what I do. But of course, like I was there where she was, and like I had a beautiful team to help me. And like I think that's so important. Like allow yourself to be helped. Like you're not alone. And like the community, I mean, I was on Reddit, I was on YouTube, I was on your channel. Like after it happened, I reached out to you, I reached out to my friends, and like it's just that place to be sucks. And I was in the park, it's those times where you park in the parking lot and you just like bawl your eyes out. And you're looking online like, did I make the right decision? Like, and I
Yes.
just, yes, it played out divinely, right? It played out divinely.
And I think Stephanie that it always plays out divinely. There's not ever a time when there's a mistake. Our animal companions, as you said in the very beginning, our animal companions are so closely connected to source. They know, they understand, and it's all divine divine orchestration. Like it's
Beautiful.
already, you cannot make a mistake. You can't make the wrong decision, and your animal
Beautiful.
companion will be fine.
Mm-hmm.
And maybe it's a conversation for another day, what they see when they do cross over, because
Mm-hmm.
immediately they're still with you. I don't know if you felt Teque right by your
Of
side, but I know I
course.
felt Lucy. I felt
Mm-hmm.
Lucy not just by my side. I felt Lucy in here. Like she
Mm-hmm.
went right into my heart, and there she stays even to this moment. She
Mm-hmm.
will not ever not be in my heart. But then the other message is that, and it's the main message of this channel of Soul Pet, is that you're not alone wherever you happen to be on
Mm-hmm.
your journey of recovery, healing, grief after the loss of an animal companion. There are thousands. There are so many people who
Mm-hmm.
will support you, even if they don't know you.
Mm-hmm.
They're supporting you because they know what they've been through themselves.
Yes.
And you
Yes.
can always ask for help. There will be somebody to help you. So beautiful.
Yes. Amen. That was so
So
beautiful.
I do have two questions
Yes.
that came from one of them. One of them came from one of my viewers who is just wonderfully becoming more and more aligned with our animal companions, not just having souls, but being um, unique, aware individuals with preferences and personalities and choices and a journey that is all of their own. And this particular person asked, "What do you think animals teach us as they approach end of life?"
Wow.
I know I didn't prepare you for that question.
What a beautiful question. No, that's beautiful. What do animals teach us when they're preparing for
As
end of
they're
life?
preparing for end of life. Yep.
Oof. Surrender.
Okay.
Full surrender. Yeah. Full surrender to their
Yes,
plan.
to their journey, right? To their plan.
To their plan.
Exactly.
Yeah.
Exactly.
Yeah.
When you think about all the animals in our lives,
Mm-hmm.
We make most of the decisions for them. You mentioned it with me
Mm-hmm.
and my beautiful Gypsy. We
Mm-hmm.
make most of the decisions. If Gypsy had her
Yep.
way, we would not be here in this freezing cold tundra. So we made the choices for them, and
Gypsy.
when it comes to their end of life, just honor them, honor their life,
Mm-hmm.
and let them um, surrender. It's a beautiful word. Beautiful.
Mm-hmm.
Thank
Yeah.
you.
Yeah.
Uh,
Surrender. I didn't he was not that he wanted to go, but he knew it was time. And they
mhm.
are so wise. I mean, the souls of animals themselves, they're so wise. They know exactly what's going on. And I didn't want it to be the way that he wanted it to be, and like I mentioned, he was a stubborn man, so he left as stubborn as could be. And he was like, this is gonna happen in my terms. And it's like,
Right.
surrender, surrender, surrender. Allow them to guide you as well. And I think something that I tapped into deeply was we're also temporary. We're also temporary. And when that was happening, it was kind of like, whoa, like death, the experience with death. It was my first
Mhm.
experience with death, right?
Mhm.
So to me, it's kind of like that is where we go. Like that is exactly where we go. So why would you not full send your life right now? Like why would you not like kiss each other and love each other and hug each other and grab each other and enjoy each other to the depths? Because you don't know if tomorrow is
Mhm.
time, or like today, you don't know that. So it's like not only surrender, but just like gratitude and presence every day. And again, it's easier said than done. But just like I love that question because it really like tapped me back into it. And although there was so much pain, I mean, I moved back in here with my family because I was put in a place where when it's time for my mom or my
Mhm.
grandma,
Mhm.
I want to be in a place where I can take care of them. I want to be in a place where I can call out of work and I can mourn for 3 months if I need to. So
Mhm.
that is my goal right now. Um I want to provide I want to get a really big home and adopt all of the pitties.
Right? I
And I
know.
just that's where I'm headed. And Teque has allowed me to do that and have the drive to be like, you know what, like it's not today, it's not yesterday, it's not in a month, it's right now because you don't know when it's going to be time for us, right? Or for them. So it's like if you
Right.
think like, oh my God, like let's plan like in a year. No, plan it right now. Plan it right now. And if you have your pet next to you, I mean like kiss those ears and those little bellies, like they're just the cutest things. And I really that's something with me. Like I think I kissed him so much and I loved on him so much that was never like I should have done more. It was just more of whoa, like death happens. It
Mhm.
just, I do it every day in my clinic, but when it's your turn, you're like, that's wild. To me, it's just a wild concept. You see their little hairs everywhere, but they were here.
Yes.
It's
But
wild.
you mentioned something that I also want to just touch on for just a moment, and
Of
that's
course.
that our animal companions, they're not afraid to pass.
No, they're
Like
not.
there's no they don't overthink it like we do. Like, we do
Mm-mm.
everything possible. Now we've got longevity doctors. We've got people telling you 100 different supplements that you should be taking every day so that you can avoid the thing that is at some point unavoidable.
Yep.
And
Yep.
but our beautiful animal companions are not afraid at all because
Mm-hmm.
they know how glorious of a journey they're on. They know how amazing it's going to be once
Mm-hmm.
they cross over and that they're still they're still connected with us. That's what they're at least teaching me every single day is that
Yep.
they are still right here by our side. And just because their little physical body stopped working, that's not the end. They
Mm-hmm.
are
That's not the end.
yeah, it's not the end at all. So there's also, they've taught me to let go of that fear. They've taught me to
Yes.
completely let go of the fear. I will give that to Lucy. Lucy, more than any of my other animal companions, taught me, Mama, there's nothing to be afraid of. And just wait. Just you wait until you see what it's really going to be like on the other side.
She's
Um,
so cute.
yep.
Elaine,
Uh,
something you said that I loved was that you feel her here.
mm-hmm.
And I would love to touch on that
Oh, we
because
can. Yes.
I feel him here. And there was a transition where I would cry out of pain, like those like 3 a.m. cries in the dark out of like
Mm-hmm.
pain and the
Mm-hmm.
the wallowing and just like I should have like, oh my God, I could have done so much more. And like now when I do cry, it's like because I feel him and he's guiding me. So I love that you said that. And I think all everyone that's listening should know that that is a part. I don't know like the five stages of mourning, but I do know that that is one part of it. And that is the best part when you feel them internally.
Right.
Yeah, it's
Because,
beautiful.
yeah, your souls are connected. They are
Mm-hmm.
forever connected. There isn't
Yep.
anything you can do. You can travel to the farthest corners of the earth and say, I'm not ever going to think about it. No, it doesn't work that way. They're your
They're
soul pet
there.
forever and ever.
They're so cute.
So I have one final question that I'd love to ask you, and that is this. If you could leave pet parents with one message, anything at all that you would like to tell them, words of wisdom, reassurance, whatever that might be, what would you say?
As a veterinarian, please find a veterinarian that you vibe with. Please. There are so many veterinarians out there. If you go to a place where your pet is not having a good time, please know that there are other veterinarians you can go to. Take them to me. And sometimes, not every vet is for everyone, but I think that's super important, especially not only end of life, but as you have a pet. Ideally, I always say I only want to see you initially as a puppy. And then at 3 years, we can talk about it, see how it's doing. As long as the pet is on a good nutrition, good exercise, good care at home, they should be healthy, right? I think there's a lot of information out there right now in the veterinary field and with ChatGPT and all. There's just so much
Mhm.
information out there. Please don't stop going to the vet. But if you're going to go to the vet, please make sure that you vibe with them and your pet does as well. Like I always say, I want to be the vet that your pet does want to come back to, right? Like that's how it should be
Yeah.
because there's no need. And I say this because I do relief and I can see places that there's fatigue, like you mentioned, there's compassion fatigue, not only for the veterinarians, but for the technicians as well. And when
Mhm.
that energy is behind such a divine career, I mean, being a veterinarian, I feel so blessed to have chosen this path. I believe it chose me, but I say it every day. Not only I do have hard days, but I will never allow my hard days to not allow me to show up fully for my patients. Right. So just know that please, please, please have a veterinarian that you trust, that you can ask questions to, that you don't feel judged about. All of the questions you have, I love answering them. Like, please, if you come with questions, your veterinarian should sit on the floor with you and allow yourself to express yourself, your concerns, what you found online, your pet, like that one little cough that they do, like let's dive into it. And also know that there is traditional Chinese medicine. Please look into that. If you can find a doctor who practices traditional Chinese medicine, you're welcome. That's something that I do. And again, I'm still learning and we're still growing. But if you can find someone that does in your wherever you live, yes, 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 please.
Okay, holistic
Yeah.
veterinary care. That might even be a topic for
Yes.
another conversation also. It has been so nice to chat with you, Dr. Juno. Where can we find you? Where can people find you if they'd like to
Yes, so you
connect
can
with
find
you?
me on Instagram, on YouTube. I am Dr. Duno, so Dogtor, and then my last name Duno. That is also my email, so drduno@gmail.com. I love connecting with you guys. Please send me all the
Awesome.
pictures. I want to see your babies. And I love you, Elaine. You're so
And the name of your new
wonderful.
business is Sana
Sana
Sana?
sana, sana
Sana
sana.
Sana. Okay, got it.
Yeah, sana
Awesome.
sana.
Fantastic.
Yes,
It has been
thank
so
you.
nice to chat with you. We have so much more that we could talk about, so I would love to have you back again for a future conversation. In the meantime, have a
Anytime.
beautiful day and thank you so much. And for everybody who's watching, we appreciate you, we love you, and know that you have a whole community of people here to support you. You are not alone.
Mhm.
Take care, everyone, and may animals light your way.